Interview questions and answers for job at Punjab Healthcare Commission PHC. Interview questions for the post of 1. Manager Enforcement. 2. Manager Monitoring and Evaluation at Punjab Healthcare Commission PHC. General questions. 1. Question. What are the key responsibilities of a manager enforcement at PHC? Answer. Ensuring compliance with healthcare standards, initiating actions against violations, and overseeing regulatory enforcement. 2. Question. What are the key responsibilities of a manager monitoring and evaluation? Answer. Developing and implementing M&E frameworks, monitoring healthcare service delivery, and assessing program performance. 3. Question. What do you know about the Punjab Healthcare Commission PHC? Answer. PHC is an independent regulatory body that ensures quality healthcare by setting standards, licensing, and regulating healthcare establishments in Punjab. 4. Question. How do you ensure compliance with healthcare regulations? Answer. Through regular inspections, audits, collaboration with stakeholders, and legal enforcement measures. 5. Question. What is the significance of enforcement in healthcare management? Answer. It ensures that healthcare facilities comply with laws and standards to provide safe and effective care. 6. Question. How do you conduct a root cause analysis for healthcare violations? Answer. By identifying underlying causes, analyzing data, and reviewing policies, procedures, and incidents. 7. Question. What tools or methodologies do you use for monitoring and evaluation in healthcare? Answer. Logical framework, log frame, key performance indicators, KPIs, data collection tools, surveys, and focus group discussions. 8. Question. How do you handle conflict in the enforcement of healthcare regulations? Answer. By following legal protocols, ensuring transparency, and resolving issues through dialogue and mediation. 9. Question. How do you prioritize tasks in monitoring healthcare facilities? Answer. Based on risk assessments, the severity of issues, available resources, and deadlines. 10. Question. What are some challenges in enforcing healthcare standards in Punjab? Answer. Non-compliance by facilities, lack of awareness, limited resources, and resistance to change. Healthcare-specific knowledge. 11. Question. What are the basic healthcare standards established by PHC? Answer. Standards related to patient safety, infection control, staffing, facility infrastructure, and medical records management. 12. Question. How would you handle non-compliance by a large hospital? Answer. Conduct a thorough investigation, issue a warning or penalty, and ensure corrective actions are implemented. 13. Question. What are the legal consequences of non-compliance with PHC regulations? Answer. Penalties, suspension or revocation of licenses, legal actions, and closure of healthcare facilities. 14. Question. What is the role of accreditation in healthcare? Answer. Accreditation ensures that a healthcare facility meets or exceeds established standards of quality and patient safety. 15. Question. How do you assess the effectiveness of healthcare policies? Answer. Through data analysis, patient outcomes, stakeholder feedback, and comparison with international benchmarks. 16. Question. What is a logical framework in M&E, and how is it used? Answer. A logical framework is a tool used to outline objectives, activities, indicators, and outcomes for effective project management and evaluation. 17. Question. What strategies would you use to improve compliance among healthcare facilities? Answer. Training programs, regular audits, incentive systems, and stakeholder engagement. 18. Question. What are key indicators for monitoring healthcare quality? Answer. Patient satisfaction, infection rates, readmission rates, and adherence to clinical guidelines. 19. Question. How do you measure the impact of healthcare interventions? Answer. By evaluating changes in health outcomes, patient experiences, and cost effectiveness. 20. Question. How can you ensure the reliability of data collected for M&E? Answer. By standardizing data collection methods, training staff, and conducting regular audits. Enforcement and regulatory knowledge. 21. Question. What steps are involved in the enforcement process? Answer. Identifying violations, issuing notices, conducting investigations, applying penalties, and ensuring corrective actions. 22. Question. How do you handle anonymous complaints about healthcare facilities? Answer. By investigating the complaint while maintaining confidentiality and ensuring fair treatment. 23. Question. What role does risk assessment play in enforcement? Answer. It helps prioritize actions based on the potential harm to patients and the likelihood of compliance. 24. Question. What are the typical penalties for healthcare providers who violate regulations? Answer. Fines, suspension, revocation of licenses, and legal actions. 25. Question. What is the importance of patient safety in healthcare enforcement? Answer. Ensuring that healthcare facilities prioritize patient safety is critical to preventing harm and ensuring high-quality care. Managerial and leadership skills. 26. Question. How would you handle a team that is underperforming in their enforcement duties? Answer. Provide feedback, offer training, set clear expectations, and monitor performance closely. 27. Question. How do you motivate your team to achieve high standards in monitoring and enforcement? Answer. By setting clear goals, providing incentives, recognizing achievements, and fostering a collaborative work environment. 28. Question. How do you handle tight deadlines in monitoring and enforcement tasks? Answer. Prioritize tasks, delegate responsibilities, and streamline processes to meet deadlines effectively. 29. Question. How do you ensure your team follows ethical practices in enforcement? Answer. By establishing clear ethical guidelines, offering regular training, and creating a culture of accountability. 30. Question. How do you balance the need for enforcement with maintaining good relationships with healthcare providers? Answer. By maintaining open communication, providing support for compliance, and ensuring fair and transparent enforcement actions. M&E specific questions. 31. Question. What is the difference between monitoring and evaluation? Answer. Monitoring is the ongoing process of tracking performance, while evaluation assesses the overall impact and effectiveness of programs. 32. Question. How do you develop indicators for an M&E framework? Answer. By aligning indicators with program goals, ensuring they are specific, measurable, achievable, relevant, and time-bound. SMART. 33. Question. How do you conduct a midterm evaluation of a healthcare program? Answer. By reviewing progress against objectives, collecting data, and engaging stakeholders for feedback. 34. Question. What is outcome evaluation in the healthcare sector? Answer. Outcome evaluation assesses the long-term impact of healthcare interventions on patient health and system performance. 35. Question. How would you evaluate the performance of healthcare staff? Answer. Through performance appraisals, feedback from patients and colleagues, adherence to protocols, and outcome-based metrics. Scenario-based questions. 36. Question. A healthcare facility is found to have violated multiple safety regulations. How would you handle the situation? Answer. Initiate an investigation, issue a violation notice, provide a timeline for corrective action, and monitor compliance. 37. Question. A healthcare provider challenges the findings of your monitoring team. How do you respond? Answer. By reviewing the findings, providing evidence, and ensuring the provider has an opportunity to present their case. 38. Question. How would you implement an M&E system for a new healthcare initiative? Answer. By defining objectives, identifying key indicators, creating data collection methods, and establishing regular reporting mechanisms. 39. Question. How do you address discrepancies in data collected during monitoring? Answer. By conducting data audits, cross-checking with other sources, and retraining staff if necessary. 40. Question. A facility fails to meet compliance standards despite repeated warnings. What are your next steps? Answer. Escalate the enforcement process, impose penalties, or suspend the facility's license if necessary. Dear pharmacists, these questions should provide you with a broad perspective on the types of inquiries you might encounter during your interview for the manager enforcement and manager monitoring and evaluation positions at PHC. Be sure to tailor your responses to demonstrate your knowledge of healthcare regulations, enforcement strategies, and evaluation techniques, as well as your managerial and problem-solving skills. Regards. Majid Badi, Advocate, Vice President, PPA Punjab. Contact 0321 404 2036. Thank you.